Okay, so this is the TR band, and the first thing you want to know when you're getting a report from the cath lab is how many cc's of air did they put into this syringe, and then you also want to know from the cath lab if it was a diagnostic or if they had an intervention, because that matters with policy on when to start removing the air from this syringe. So we have this syringe for air titration to better control this bleeding from this artery here. So you have this green dot that's on this band, and that's sitting over the artery, and when you might see a little blood underneath that, because in the cath lab when they remove the sheath and place that band, they have a little bleed back in there, so you might see a little bit of blood in that band. Then for a diagnostic procedure, after an hour, that's when we start taking the air out of the syringe. And so you have this special syringe, and you want to make sure that when you get it from the cath lab that you have this type of syringe, and you would take that and take out 2 to 3 cc's of air, and then assess the site. And so as a part of the assessment, when they come to the unit, you want to make sure that they have you can put a pulse ox on it to measure the waveform, but you want to make sure that the coloration on the hands, that they're not it's not cyanotic, that you have an ulnar pulse, that you have movement in the hand, and that there's no pain in this area. So, and you have a cap refill that's less than 3 seconds. And so when you're taking the air out of this, you want to make sure that there's no bleeding. So then after 10 minutes, you can take another 2 to 3 cc's of air out of that balloon here. And then once you get it all the way out, you just want to make sure that you don't pull out all the air at one time. So you get it down and to remove this. And so when you remove this, you take the Velcro off after you got all, let's say that the cath lab, so they put in 13 cc's of air. So after you get the 13 cc's of air, you remove the Velcro from this, and then you put a sterile dressing over that site. And then after 6 hours, you instruct the patient that they need to limit the movement in this arm for 6 hours, and then that you don't do lab draws for IV sticks or anything, do manual blood pressure cuffs or anything in this affected arm. And if you had to put on a pressure dressing, then make sure that you're taking that pressure dressing off within 6 hours.
What if it's a procedure, not just a diagnostic?
Okay. So if you did a procedure, then you wait 2 hours before you take that. You start taking the air out of the balloon, and then after the band is removed, then you want to get your vital signs and do the assessment on that artery every 15 minutes times 4, so for an hour, and then every 30 minutes times 2, and then every hour times 2 to assess the site, assess for the color, pain, and good cap refill, and then making sure that you have both of these pulses here. For the TR band, if you take it off and you notice that there's bleeding in here, then you would want to go ahead and put that 3 cc's of air back in and observe the site. Okay, and when you're assessing the site, you also want to assess the site up this way from the arterial stick. You want to make sure that you don't have a hematoma this way, because that could mean that there's too much air in this bladder here. And so you might want to take 1 cc out and see if you can express this hematoma out.